Welcome to Sex on the Floor podcast. This podcast was created to help educate the public about problems with sex and intimacy and how this is tied to both physical and mental aspects. Hosted by myself, Dr. Molly Hart, a passionate pelvic floor physical therapist and owner of Pelvic Balance Physical Therapy, and by Dr. Katie Schubert, a phenomenal sex therapist and owner of Cypress Wellness Center. We are here to have a good time. We're here to keep it real with you all and to educate along the way. I'm so excited for you to join us. We strive to help many relationships prosper in fun, safe, and healthy intimacy. While listening to the show, please remember that this information is not meant to diagnose or treat any medical conditions. Please speak with your medical provider for all things related to your healthcare. Hello, all. Welcome back to Sex on the Floor podcast. I'm here, Dr. Molly Hart, with...
And I'm Dr. Katie Schubert. We're here and we're going to be talking about returning to sex postpartum. We've hit on postpartum mental health and postpartum bodies a little bit in the last episode, in last episode of our postpartum series, or I guess pregnancy series. But we want to talk a little bit more about sex and how sex can and maybe should happen after having a baby.
Yes. So a lot of misconceptions also with postpartum sex. There's this weird rule out there that at 6 weeks, I can have sex again. After my 6-week checkup, I get to have sex. And so I'm going to sit here first up and say, I am not in support of this weird made up rule. And I want to talk way more about safety for you emotionally and physically before you resume intimacy with your partner. And all the complications that are going to play into this. And hopefully the goal of this is to give you more understanding, more compassion for yourself, and just really being kinder to yourself and not think, because this is a common thing I hear from my female patients is, oh, but like at 6 weeks, like I have to have sex with my husband again. Like he's been waiting so long. He's been so patient. So I kind of want to help with this episode to give you more understanding of where you might emotionally be at, physically be at, and giving yourself some serious love and compassion of when it is appropriate to be intimate with your husband again or partner again, and it not be this pressuresome thing that you place upon yourself with all the 500 other million things you place on yourself with being a new mom.
Yes, absolutely. Like being interrupted by,
But okay. I know. This is why I'm outside. So Katie's inside. I was first in my van and couldn't get my internet working. And now I'm outside because I can't go in my own house because it's kid territory.
I thought I locked the door, but apparently I didn't. So.
Bye. My baby is leaving the house with the nanny.
Oh, lucky you. Okay, well, we're gonna try to do this with her in here. She said she's gonna be...
How are you with the language we're talking about in her? Fine?
Yeah. She tells all of the neighbors that she has a vulva and her brother has a penis. So they all now know.
Because I say vulva too. I'm like, wipe your vulva now. And I'm like, people are going to think it's so crazy.
Well, now the whole neighborhood knows the correct terminology and they can thank me.
I am now in the process of teaching her like literally everything anatomy that I can think of. I'm like a whole body. And so I'm like, you're going to learn, you're going to know, because then if anything happens to you, you'll be able to tell me exactly what happened versus my patients who have 7-year-old daughters who say my vagina hurts or my butt hurts. And then they say their butt hurts and they point to the vagina, or they say their vagina hurts and they point to their butt and they have no idea the difference. That I'm like, this is not acceptable.
Yeah.
Like,
yeah, that's ridiculous.
No 7-year-old boy doesn't know the difference between his butthole, his testicles, and his penis. So why are we not knowing the difference between the holes?
I know, it's ridiculous. No, she actually, my giant penis came in the mail the other day, and she showed the neighborhood children. And I was like, okay, that's one step too far. Mommy's gonna hide the penis.
She showed your giant penis model to the neighbors.
She sure did, because it had just come in the mail and I had just unpacked it and the kids busted in and the penis was sitting right there.
Oh my God. That's hilarious. Did you have to tell their parents, like, hey, we had a penis model?
No, I just prayed that nobody went home and said, hey, I saw a big penis at Katie's house.
I mean, they probably know what you do for their living. They're like, oh, yeah, it's just Katie.
Oh, I don't live in that kind of neighborhood. They're very careful about
everything.
Yes.
Oh,
yeah.
You know, I thought I lived in that kind of neighborhood, but then I go to neighborhood parties and these parents get wild and we're like on the water and they have pools and there's just kids running around everywhere. No one's watching them. I'm like, all right, like I'm going to be the sober one trying to make sure nobody drowns because like we live in Florida and that's the number one reason why kids die. But like, all right, you guys all know they're like wild here. I am tame in my neighborhood and that makes me feel really good because I don't feel tame.
Yeah. Right. James, I need you to come get her. I'm trying to do a podcast and it's not working very well.
It's working great. I think it's working exactly as it needs to with two moms trying to do a podcast about postpartum sex.
Where's she?
Under the bed. She said she's gonna make
Come on. No. You gotta come out.
Okay. I actually like hope we keep some of this in there.
I'm cool with that.
Viewers will love us. I mean, seriously. Okay. Anyway, so I'm gonna let you lead.
Okay. So I do get a lot of couples in and they're postpartum and one of their biggest complaints is that sex isn't happening. But when you ask more questions about why sex isn't happening, there's a laundry list of things that are going on. We touched upon most of those in the last session, or the last, I've been doing the last episode. So like she's touched out, she doesn't have any energy, he doesn't have any energy, he's feeling neglected, right? There's a lot of reasons why sex isn't happening. But as you mentioned, there's the 6-week rule that most, I think, OBs tell their patients you can have sex after 6 weeks. And a lot of women feel like they have to make that happen at that 6-week mark because either their husbands are waiting or they have internal pressures or they're just not feeling connected to their partner because they haven't had sex for 6 weeks or longer. But you know, a lot of women say that if they do try to have sex after that 6-week mark, it still really hurts.
Yeah.
Even after a cesarean. And I think we also talked a little bit about that in the last episode.
I think we touched like a little bit on it. So that's why I want this episode to be more in depth in it. I should have pulled these stats up, but there's some pretty good stats to indicate, I mean, gosh, 6 weeks postpartum. I don't recommend anybody has sex from a physical standpoint. I would wait minimum 8 weeks. And that's just because of the way the tissues heal. So any type of tissue injury you have in your body, no matter what it's from, it's going to take roughly 8-ish weeks for that tissue to heal. A broken bone, a sprained ankle. I mean, you list it, you name it. So if we're having a vaginal birth or a C-section, both types of ways the baby's coming out, you're having significant tissue injury that is occurring. The body will heal. It's okay. Tissue injury isn't the end of the world, but we have to respect the human body. And, you know, the thing is the human body is so slow to adapt and to heal. And in our society now where we have instant everything, that's, I think, the biggest problem I see is people are not aware of how slow the body is and very patient with it. It takes it 10 months to make the baby. It takes so much time for it to heal. The thing that's hard to understand too is, you know, it takes a second to destroy anything, to destroy a house, to get in a car accident, destroy your car, to destroy a life. A person can die like that. I'm not trying to be like morbid, but that's the law of entropy. Like, it's just chaos. So to build something up and to be in a better, healthier state requires tremendous time and energy. So it's important we're really patient with ourselves. So if everything goes well with your birth and your pregnancy and the C-section's healing well, there's no infections, there's no serious nerve injury. Cool. 8 weeks, I think, is a good time. Physically, we can say, okay, but are you really ready to? And you still need to go slow and be gentle with yourself. You don't just go right back into intimacy with your partner.
Yes, absolutely. I tell my clients that all the time. I say, it's a really great time to remember all of the things that you liked that don't always have to do with intercourse. So, play around with foreplay, do other things that, put your bodies together in an intimate way that doesn't include intercourse.
Yeah.
Because really there's a ton of things you can do to achieve pleasure in a relationship, or to achieve intimacy or closeness in a relationship that doesn't have to do with intercourse. But when couples are together for a really long time, they often just skip right to the intercourse because it's like the thing that they want to get to. So it's a great time to push that pause button and get back to kind of the basics of what makes you feel connected to your partner.
Yeah, I agree. There's really the biggest thing I've been learning a lot myself, even because I'm taking a sexual course right now, is we have such set rules when it comes to intimacy, especially with heterosexual relationships, which is, I would say, the set kind of cultural rule is I, as a woman, need to be sexually available for my man, and it's the pleasure is just for him, so he can orgasm, and like it's all about him. It's all about pleasing him, and I just need to do my duty, my chore as a wife. Like, I feel like that's kind of the weird message that a lot of people have, and I would like, if you can, to try to literally throw that message away, because it's just not helpful. It's not accurate. It's not proper. Intimacy, if you want good intimacy with your partner, doesn't have to be intercourse. There's emotional, there's physical intimacy. And if we think about it like from the physical standpoint, when you were pregnant, what felt good? In my course I was doing the other night, we were talking about how a pregnant woman was saying she loved when her husband would rub her belly. And so then postpartum, she didn't have her belly anymore, but she still then added that in. Let's rub the belly. It still feels good. So like, what are things that you can physically do together that allow you to be really mindful and in the experience and having a safe, pleasurable experience physically with your body? That can be the touch, it can be smell, taste. I mean, all of these sensations, and it doesn't have to include penis into vagina penetration. What are things we can do for foreplay? What are some fun things we can do with toys? So if this is stuff maybe you didn't explore quite as much, maybe before you had a baby, I would say it's more important now, because if we don't start adding in positive association, fun, pleasurable, positive association with intimacy with your husband, it is going to be last on the totem pole always, and probably just not going to happen. And slowly, little by little, there is going to be a drift in the intimacy in your relationship that can easily happen after a baby comes. It takes, I think, very intentional effort when you're in a couple with a baby to keep your intimacy alive. That's my perspective.
Yeah, absolutely. And also I want to add, if you think back to like your high school psychology course, if you had one, or your like Psych 101 in college, probably the first thing you learned was, the Maslow's hierarchy of needs. And pregnant women are very low in that hierarchy, right? Or, newly non-pregnant women. So, postnatal women. So they're lacking sleep. They're lacking energy. Their hormones are all messed up. They might be suffering from anxiety or depression because of the hormonal fluctuations. So when you think about Maslow's hierarchy, when you've just had a baby, you're working on those lower level needs.
Oh gosh.
And sex is way up here. So, I mean, if you're a new mom or a new parent, it's really important for you to give yourself some grace when it comes to achieving those needs. And it's okay to be in those lower level needs for a while, catching up on sleep, letting your hormones rebalance, so you can feel kind of normal again, letting your body heal. Your body's not going to feel like your own. I remember right after I gave birth, probably a week or two afterwards, my belly felt so funny. It felt like a bag of jelly. Like it was empty, and it was like this empty vessel I was carrying around, and it moved like jelly, and it did not feel like my body at all. Yeah. And even still, today, I had my baby 7 months ago, and I was working out this morning. I cannot move my body the same way that I did prior to having him. I can't do flutter kicks, right? Because of the C-section. So it takes so long to feel like your body is your own again, and that you have the strength to do the kinds of things that you want to do with your body, that I can't stress enough the importance of giving yourself time and grace when it comes to, you know, meeting those upper level needs with your partner, which are things like full on intimacy.
Yeah.
You know, when you're trying to feel safe and secure again in your body, in your life, in his presence or your partner's presence. And don't rush it, because you have a long time to figure it out. It's not like everything has to be crammed into that 6-week period or a 6-month period.
Yeah.
It's a slow process.
What would you say to the couples that, because I've had this where the male partner really wants to be intimate. He's telling his female partner, like, this is really important to me. We need to get this worked out. I had a patient recently, like, there was this like biological need. She's like, my husband needs to have sex. He can't not have sex right now. So that was a part of why she was coming to see me. What do you tell couples that are women, especially, who maybe have a partner who's not patient, who's not able to necessarily give the grace that she needs because he's so focused on his sexual needs? Because that happens.
Yeah, I try to do a lot of psychoeducation with them. It's hard for men to understand what your body goes through and what your brain goes through. And what your pelvic floor muscles go through. Yeah. It's really hard for men to understand. The first night I brought my third child home, I'd never experienced this before, but I sat in this very chair and I broke down for no good reason. There was no good reason for it. I just could not stop crying. And James, my husband, was walking by and was like, "What's wrong?
Yeah.
What's going on?" And that made me cry more, because I'm like, what's wrong? What's going on? Yeah. Like, I just had surgery. I have a baby. I'm tired. Like, I don't know if I'm hungry. Like, I don't know what's going on. I can't stand up.
What isn't wrong? Like, what isn't wrong is the question.
I'm wearing old lady diapers right now because I'm bleeding so much. Like, yeah, what's wrong? And he was tired, right? Like, he had hung out in the hospital for a few days with me and eaten hospital food, but like, his body was still perfect. And mine was a complete fucking disaster.
For the third time. For the third
third
time. For how many years now? How many years has the body been a disaster for you now?
Yeah.
But for real, how many years? When did you get pregnant with your first child?
My body has been a mess for about 6 years.
Yeah. So that's another thing. Like, depending on how many children we have as women.
Yeah.
Because I don't feel like I ever feel even semi good in my body again until at least a year postpartum. So I'm not a little bit over a year and I'm still not even fully there. So you keep adding on kids and it's just, now 6 years, and then it's a restart. Every time you have a baby again and you're postpartum, it's like, I got to start all over again with rehabbing. I got to start all over again. And it's when you're already so defeated feeling to know that you have so much work to do at your house every single day to care for these kids, let alone for your own body to like be at a place where you feel like it's your body again, it can kind of hit you at times and you're just like,
yeah. And the last thing you feel is sexy. It's like, this isn't sexy. Like, I'm leaking, like in the very beginning, you're leaking from like every hole, right? Like your vagina is leaking.
So is the baby. There's fluid everywhere. I tell people, I'm like, it's a fluid nightmare.
It is, and it's not sexy at all. And then like, add breastfeeding to that, add pumping to that, it's not a sexy time.
You got spit up on your outfit because maybe you just fed from your nipples. That's now leaking on your shirt. And now they spit it back up on you. And then they had an explosive poop that also got on your, like it's beautiful too. Like, I actually do think it's a beautiful time, but is it sexy? No, I think it's comical. I had a lot of laughs. I mean, you just have to laugh because it's just so ridiculous.
But that's what it is, right? It's like you and your partner are bonding in a different way. Like the sexual intimacy might not be there, and that's okay. Take that time to like get to know your partner in a different way, because that is like such an experience that you can have with a partner. And you learn so much new stuff about each other in that time.
I agree. Like I will say, I think after I've had kids, I have allowed my husband to take care of me more, especially because I lost my mom. So I'm like, I sometimes just want to be cared for. I want to be mothered. When you become a mother, you want to be mothered so much. So if you have a husband who is capable, and if he doesn't know how to do it yet, if he's capable, if you're able to kind of help teach him, how do you like to be mothered? And that is intimacy right there. And that can be like for me, him rubbing my feet. Sometimes he'll want to be intimate with me and I'm like, I just don't want to be. And then he'll rub my feet instead. And I'm like, this is great, wonderful. Or just lightly just rubbing, not even like a scratch, not even a massage, but just like a light rub. The most simple things, getting me some tea because I'm just laying in bed, finally resting. So these little simple things that you can learn how to recreate intimacy. It's going to be 100% different than it was before the baby came.
Yes.
Last little bits I want to go over from a physical standpoint is if you did experience a pudendal nerve injury. So the pudendal nerve is what innervates the clitoral tissues, the urethral area, the vagina, the perineum, the rectum. There's 3 branches to it. And so if you sustained a little bit of an injury to that nerve, which can happen after a vaginal birth, you can have pain and or lack of sensation and or weakness. And so we can see, stress incontinence. So that cough, laugh, sneeze, you're leaking a little bit. Again, more fluid, doesn't feel sexy. And you might be having some pain. The pain, because we tear a lot at that perineal body, that vaginal opening, the pain often can be right at the vaginal opening. And so if you're experiencing that, some simple things that I can tell you to do is, this sounds ridiculous, but if you take your thumb and after you go pee and you've, cleaned everything up, because there's a whole protocol to take care of your vagina after you have a baby. It's so much work, which I probably should just quickly mention what that is. You should have a perineal bottle that you put lukewarm water in and a dash of soap in, and you always are going to use that to clean yourself afterwards. You don't wipe. And you should hopefully have that witch hazel pads that a lot of hospitals will give you. And I always put 3. I put one on the clitoral tissues, one on the kind of vaginal opening perineal body area, and then one on the rectum. And then you pull your, little diaper pad device up, whatever it is you're using. But make sure you're doing that after every single one. You really want to take care of these tissues. And then if you can do sitz baths, wonderful. I hate the sitz bath bucket they give you. It is way too much pressure on your perineum to be sitting on the toilet like that. Absolutely not okay. What I would advise instead is if you have a bathtub, lay down completely flat in the bathtub and just like completely flat. If you're not on like your back is and your head is on the bottom of the bathtub. Fill up enough water just to cover the whole vulva area. And put some Epsom salt in there. So that is wonderful to help calm. You don't want the water crazy hot, but you want it to feel warm. And like 20 minutes every day that you can have the energy to do that, do it. So that's going to help the tissues heal quicker. That's really, really important. If you have a C-section, more what we see with intercourse being a problem is deeper penetration because of where the stitches and everything is. So you're not going to see as commonly that the opening is going to be the bothersome area. For that, this is not easy. And we talked about this last time, Katie, is, massaging that area, touching that C-section scar, which is so hard for to do as moms, mainly, especially when it's an emergency C-section. So if that's something you're struggling with, like maybe you can find a provider, a pelvic floor PT, and or there's other providers who will do abdominal massage gently to help create new safety around that area of the body. That's pivotal is for us to feel safe around these areas that have torn because they're trying to heal, the nerves are. And when we cognitively hate that area and dissociate from it, it actually prevents the nerves from healing properly. So from a physical standpoint, it will make it even harder to rehab and to connect with your body safely again. But if the vaginal opening is sensitive, one thing that's so easy to do is you take your whole thumb, put it in the vaginal opening, and then you're going to put pressure straight down. So if here's my vaginal opening for those watching, and I put pressure straight down, I'm going to use my thumb too. Most of the pressure will be on the web of your thumb because that's at the opening. You're going to push straight down until it creates, you're edging the discomfort. You're going to have some discomfort there. Don't push into the pain, but edge it, and then do 5 really deep diaphragmatic breaths. So you're going to deeply breathe in for 4 seconds and exhale for 8 seconds through pursed lips. So count 5 times on your hands, and then take your thumb and move it just slightly over, just like a little edge, and pull to the side. So that's going to look like this. And you do that on the right side and the left side, just those 3 things. That can help tremendously. I've had a lot of friends that are like, oh, sex is kind of painful right now for me. I just have them do that after they go pee a couple times a day, and they're like, oh my God, it worked. But if you're having more serious pelvic floor issues, then you need to go see a pelvic floor PT, because unfortunately, it does not just go away. The stats on pain with intercourse postpartum are really pretty shocking. How many women, more than 50%, like have pain even, I think, 6 months postpartum, which I was shocked to see that. So way more common than I realized. Simple things you can do. I have an online course called the Happy Bee Formula that's very cheap, I think, and you can go through the whole protocol on there if it is more significant. You don't have the money to see a pelvic floor PT, but don't allow pelvic floor concerns after birth. When you finally have the ability to focus on it, like you're not in that lower stage of survival like Katie was talking about, please seek out help, because pelvic floor concerns, they don't just go away. They actually just get worse and worse as we go on, and especially as we add on additional pregnancies and labor. So simple things that I want to kind of bring to your attention. Last thing is, because the pudendal nerve does innervate the clitoris, after a C-section and or a vaginal birth, you can have a lack of sensation in the clitoris that starts to occur. It's a really common thing. This actually happened with me after my daughter's birth. Again, doing Kegels, so rehabbing that pelvic floor by squeezing the muscle, is a wonderful way to help that nerve re-innervate. And then, this sounds silly, but doing what we call sensory discrimination around the clitoris and around the toes. So actually within our brain, where the genital region sits, it's right next to the foot. And so you can do silly games like having your partner touch a certain part of your toe and having to guess where it's at, or they can draw things on the toe. They can draw things on the vulvar, like the labia majora, or right above it. It doesn't have to be on the clitoris itself. And then you have to guess what it is, like these fun sensory games. And that's a great way to help that nerve to become more aware of the sensations that it's getting as it's healing, because it's a peripheral nerve. It got damaged. It can heal, but you have to help it heal properly.
Mm-hmm. That's good information.
Yeah, so that's big things I want to hit on, and I'm kind of done there because I don't want this episode to be too long.
I know, right? We have a bad habit of just talking and talking and talking, but it's good. It's good stuff. It's good content.
Is there any other things you feel we didn't hit?
I don't think so. I think that we've covered a lot in this pregnancy series. And again, like if you're listening and thinking about getting pregnant or are pregnant or just had a baby and have other questions, please reach out to either one of us, and we will make sure to, speak to those concerns or questions, maybe in our next episode, or maybe we'll just contact you directly with some answers.
Yeah, absolutely. So perfect. I'm excited for our next episode that we have coming out to you guys. We are going to be covering anatomy for her and anatomy for him. So stay tuned for those fun episodes. Of course, the YouTube videos on those are going to be a little bit more helpful.
Yes. All right. Well, thank you all for listening. And we'll have probably new episodes published every few weeks now.
Yeah. All right, guys. Thanks for listening. We'll see you at the next episode. Bye. We are Dr. Molly Hart and Dr. Katie Schubert, and you've been listening to Sex on the Floor podcast. We really hope that you enjoyed this episode. If you have any questions and want to get in contact with us, you can follow us on Instagram at Dr. Molly Hart and at Dr. Katie Schubert, on Facebook at Pelvic Balance PT and at Dr. Katie Schubert. And for more information about us on our websites, you can find us at pelvicbalancept.com and at drkatieschubert.com.